Community Analysis of Seminole by Jessica Vault. Seminole became a city on November 15, 1970, and had a population of 2,700. The first mayor was Russell Stewart. It is the youngest city out of 24 municipalities in Pinellas County. Seminole is 1.5 miles away from the Gulf of Mexico and halfway between Clearwater and St. Petersburg. Seminole covers 5.6 square miles of land. In 1984, the city grew to 5,000 residents. On September 8, 1994, voters decided to change from a mayor to a city manager form of government. In May 1995, Frank Edmonds was hired as the first city manager of Seminole. From 1999 to 2008, the population doubled to 18,862 residents. Most of the housing in Seminole is comprised of single-family homes, condos, apartment complexes, and mobile homes. There is low-income housing at Pinellas Village Seminole, which are low-income tax credit apartments comprised of 72 units. Seminole does not have as many low-income housing as compared to surrounding cities such as City of St. Petersburg. Also, many of the homes are older, which poses a problem when buying or selling houses in this community due to buyers wanting turnkey new homes. Seminole has 6 elementary schools: Bardmore, Starkey, Orange Grove, Oakhurst, Bowder, and Seminole Elementary. It has 2 middle and 2 high schools, Osceola and Seminole, and 1 college, SPC Seminole campus. There are a great variety of churches within the community, such as the First Christian Church, Oakhurst United Methodist, St. Anne of Grace Episcopal, Seminole First Baptist, just to name a few. In 2003, SPC and the City of Seminole collaborated to provide the current community public library. There are many stores and shopping centers in Seminole. In 1965, the first portion of the Seminole Mall was created. Currently, the old Seminole Mall is under renovation as the Seminole City Center, bringing multiple new businesses to the city, such as Earth Fare, Ulta, Petco, Home Goods, and a new movie theater. These businesses will also bring much more traffic and possible pollution to the area. Seminole has grocery stores such as Winn-Dixie, Publix, and Earth Fare, and pharmacies like CVS and Walgreens. In 1992, the City Recreational Center opened, and in 2011 it became open to the public. It provides an area for physical activities for the community, such as swimming, fitness classes, a gym, sports leagues, and arts and crafts. The population at the last census was 18,153, with a population density of 3,537, which is slightly higher than the density of Pinellas County at 3,347.5, and significantly higher than the population density of Florida at 350.6. 89.5% of the population is Caucasian, 16.8% of the residents are ages 50 to 59, and 59.1% of the community are ages 50 and above. This creates an increasing need for healthcare facilities and primary care offices. Only 45% of the community is employed, most likely because most of the residents are retired. This can possibly lead to lower incomes in the community, as 53% have low yearly incomes of below $50,000. 10.7% of the population lives in. According to the Florida Department of Health, which includes Seminole in the Pinellas County statistics, the leading causes of death are cancer, heart disease, chronic lower respiratory disease, stroke, and diabetes. This is most likely due to the older age of the population, which puts them at a higher risk for all these conditions. The most common communicable diseases are STDs, such as chlamydia and gonorrhea. Seminole has some assisted living facilities, skilled nursing and rehab centers such as Freedom Square located near Lake Seminole. The facility accepts Medicare, Medicaid, private insurances, and offers many amenities such as a chapel, fitness center, library, and a pharmacy. Arden Courts is a memory care ALF. Emergency care center can be provided at Bardmore Emergency Center, located at the intersection of Bryan Dairy and Starkey Roads on the outskirts of Seminole. It is open 24/7 and is a full emergency service center with 15 private treatment rooms. If a hospital admission is required, the patients are transferred to a Baycare hospital. There are also walk-in clinics such as Bayfront Convenient Care, which offers occupational medicine, EKGs, x-rays, lab works, and free blood pressure monitoring. It is open Monday through Friday, 8 to 7, and Saturday, 9 to 3. There are also many primary care facilities, such as the Seminole Family Health Center, which accepts most major insurances and offers an uninsured discount. The following are 3 Healthy People 2020 objectives picked for the Seminole community. The first is Cancer, C20, increase the proportion of persons who participate to behaviors that reduce their exposure to harmful UV rays and avoid sunburn. This was picked because cancer was a top leading cause of death in the community. The community is located close to the beaches and is in the Sunshine State, which puts the residents at a high risk of exposure to UV rays. The second objective, Older Adults, OA2, increase the proportion of older adults who are up to date on a core set of clinical preventative services. This was chosen due to the high number of population ages 50 and above. Old age is a high risk factor for many diseases such as heart disease, cancer, and stroke. And the third objective, Tobacco Use, TU5, increase recent smoking cessation success by adult smokers. During the windshield survey, I noticed many people at the bus stops, in cars, and on sidewalks smoking. Walsingham Park, Seminole City, and Lake Seminole are a few of the parks located in Seminole. They are open to residents and non-residents and offer many options for physical activities such as trails, playgrounds, fishing, boating, and volleyball. There are city departments for the safety of the residents, such as the fire department, which has 4 fire stations in Seminole, and that are also contracted out to provide services to surrounding communities. And there's also the police department, which is contracted with the Pinellas County Sheriff's Office. There are public works that help to promote the cleanliness of the environment. Pinellas County Utilities provides water and sewage services. Incorporated residents utilize waste management for waste disposal, while unincorporated residents can choose their waste disposal provider. As stated earlier, the Seminole Recreation Center is available to all Seminole residents and also non-residents, and offers various options for physical activities. Public transportation is through the Pinellas Suncoast Transit Authority. Buses have routes on all major roads in Seminole and are handicap accessible. Residents can ride bikes on the Pinellas Trail, bike paths on the side of the road, or on the roadway on certain designated roads. A study found that in the population of adults 55 and older, cycling was a specific physical activity that has a strong association with reducing the risk of heart disease. 13 to 51 minutes of cycling a day can decrease the risk by 6%. I noticed during the windshield survey some issues with the Seminole's environment. There were some areas where there was trash on the road and in ditches. There were also areas without sidewalks and unincorporated areas which did not have streetlights. The government system of Seminole is comprised of a mayor, a vice mayor, city manager, city clerk, city attorney, and city council. The city mayor is elected and presides over the city council meetings and has a vote but no administrative or executive duties. The city manager is appointed and acts as the chief administrator of the city. The city council is comprised of the mayor and 6 members. The council holds meetings twice a month where city policy is discussed and established. Citizens can attend the meetings or watch them online, and they can reach council members by email or by calling City Hall. The following slide shows graphs of the source of Seminole's budget and its expenditure. In the last 9 years, the tax rate has remained the same. There is a 3% decrease in the budget this year from last year, with reductions made in administration, community development, and public works. The community appears to be in good economic. The following are 6 community problems which have been prioritized due to Maslow's hierarchy of needs. Problem number 1 is that there are no hospitals in the community. Residents must travel to Largo Med or Morton Plant Hospital. With the high number of elderly population, there is an increased need for emergency centers. The closest is Bardmore, which has only 15 rooms, and if a patient needs to have a hospital admission, they then have to be transferred to a hospital. Problem number 2 is poor nutrition. Heart disease is a top cause of death in the community. There are multiple fast food restaurants, diners, bars, and convenience stores which offer cheap, fast food with poor nutritional value. With those on limited income, such as the elderly, that can afford these types of food and are drawn to it. The third community problem is cancer. During the windshield survey, I noticed many people smoking. Smoking increases the risk of many different types of cancer. Also, Florida is known as a Sunshine State, and this community is located near beaches and has many homes with pools. The residents are exposed to UV rays and have an increased risk of skin cancer. Number 4 are that there are a lack of homeless shelters. 10.7% of the population is living in poverty. There are no homeless shelters located in Seminole, and the closest is Pinellas Hope in Clearwater. There are many churches, however, in the community that provide food to the homeless and those that can't afford it. Problem number 5 is traffic. The high population density means that there is a high amount of traffic on the roads. This high number of traffic leads to motor vehicle and pedestrian accidents and increased pollution. With the addition of more businesses in the area, there will be an even further increase in traffic. And the last problem is the lack of streetlights and sidewalks in areas. Unincorporated sections of Seminole are not provided streetlights, which can lead to an increased crime rate and pedestrian accidents. And some areas do not have sidewalks for pedestrian safety. A community issue that is also a global issue is traffic. In Seminole, most accidents occur between October and February. This is also during the time of an increased population due to snowbirds. The number of fatal accidents per 100,000 people in 2013 was 22.4 compared to the Florida average of 10.5, and the number of pedestrian fatalities per 100,000 people in 2013 was 16.8 compared to the Florida average of 4.2. Traffic crashes are the leading cause of death in healthy Americans living or traveling abroad. 1.25 million people are killed around the world each year. By 2030, road traffic fatalities will be the 7th leading cause of death globally. Traffic accident and fatalities can be preventable. There are laws against texting or using cell phones while driving, laws on wearing seatbelts, speed limits, and recommendations for child safety seats. People should avoid riding in overcrowded, overweight, or top-heavy buses or vans. Globally, countries are further developing safety of vehicles and improving the safety of road infrastructures. A community health nurse can provide education on driving safety, such as wearing seatbelts, driving without distractions, and proper child safety seats. They can also encourage residents to have child car seats, which are inspected for proper installation by the Pinellas County Police Department. That concludes the presentation for the community analysis on Seminole. Thank you. Presentation on the analysis of the community of Seminole. Thank you.